Really excited to see all of you here today. Thank you so much for your patience as we had to pivot with our presenters and the subject that we were going to present on. We were really excited to hear about the new suicide prevention resources here in the state of Utah, but our presenter had an emergency. And so we're going to work really hard to reschedule that one because I think it's really valuable information. One last plug for our coalition member survey. Hopefully everyone has got all of the emails that we've been sending out about it or have seen it on the Facebook page, but we'd really love any feedback that you have for us. We want to make the UPCA as effective as possible, and so we really need to know what coalition members need and what you're seeing and how we can help you better. Just make sure that you are kind on your feedback. We're very sensitive. All right, I'm very sensitive, but you guys have all been really kind and very supportive, and we really appreciate that. So one last plug for the survey. If you haven't had a chance to do it, please do that. And we're going to do a drawing for some free registrations to fall conference to everyone that has done the survey and put their information in for the drawing at the end of this webinar. So if you haven't had a chance, you still have like 45 minutes to do that. And if you need me to put the link in the chat, just let me know. I also wanted to put a plug in for fall conference. Hopefully most of you guys are going to fall conference, but if you do go, the UPCA is going to be doing a breakout during fall conference, and we'd love to see you all there. It will be an opportunity for us to network together as coalitions. Oftentimes we get these opportunities at like the Winter Summit or Bryce Canyon Coalition Summit, but we recognize that not everyone is able to be at these conferences, either schedule-wise or financially, so that just gives us another opportunity to get together as a coalition. Oh yeah, and PopCon, yeah. As coalition members and coordinators and state staff and network and just learn from each other, which is the whole point in the UPCA, right? So hopefully we will see you all there. And if you have any questions, please feel free to reach out. Without further ado, I'll turn the time over to our awesome presenter, Susanna Burt, who so graciously offered to fill in when our original presenter had an emergency. We're super excited. All right, well, I'm super excited, though to be fair, I'm always super excited about stuff, but I'm very excited to learn more about what we can do as coalitions to help with the legislative process this year and kind of where we are. So thank you, Susanna.
Well, I thank you, Heidi. And I actually took a little bit of liberty because I knew we had some things we're still working on. So I did throw a little bit of the mental health stuff in. And part of the reason we had actually wanted to have our that discussion on mental health is not only do we have a lot going on and that it's a very important subject, but next month is a lot of mental health awareness month. And we really wanted to make sure you had some resources to search to or go back to. So I will highlight a few of those. I am not the key person to know everything about mental health. I just want to make that very, very clear. Not that I am not smart or that I don't know these things, but I think there are people who have spent more of their career doing that. Without further ado, today is the first day of school in my area. So I was trying to look very schoolish. So I have my library, my fantasy library behind me. And I'm wearing my glasses, even though they do help me see. Some of you don't remember me when I used to wear glasses because I got LASIK, and now I have to wear glasses again because I get old. But welcome to Policy, Mental Health, and Coalition. A lot of stuff you're going to be going to do this year. And come on. Okay, so what we're going to discuss today is there is upcoming policy and what we can do now because the legislative session starts in January, but there's a lot of work that happens now that we're going to be impacting. And then we want to prepare you for September, give you some options, and make sure that you have a plan for both things. So as I noted, today was our first day of school. That is my senior in high school. Yes, that is those of you who have been around long enough, that is Maggie. And Maggie used to go with me to my site visits around the state. And now she's a senior. So yes, I am that old. But there's a couple of things coming up. we've got the beer tax grant and the tax amount. We've got cannabis policy that's going to be coming out, and the e-cigarette tax that we want to match the combustible tobacco tax. And locally, we want to look at those ordinances for beer gardens for one-time events. Real quick, there's a lot that we want to do this year that we want to be proactive. A lot of the years we've spent working on policy, we tend to be reactive. We tend to end up having our oh my gosh, we have to fight this. Oh my gosh, we have to be able to do these things. We want to make sure that we present policy and we show those around us what good policy is. So the boring news is that I'm still meeting with some people about the beer tax grant. What is the beer tax grant? Glad you asked. So we have funding that we receive at municipalities or cities that comes back from the state based upon the tax that we collect for the purchase of alcohol, specifically beer. Last year, for example, we increased said tax by less than 1 cent a drink. And that money won't be going necessarily to the beer tax amount. It's going to the State Bureau of Investigation for their compliance officers. However, there's a large chunk that goes into the beer tax grant. These dollars go to the cities, municipalities, and they are allowed to pick between treatment, prevention, and law enforcement ideas or strategies that relate back to decreasing the overconsumption and harms related to alcohol consumption. This could be prevention, it can be treatment, and it can be something that the law enforcement agencies, whether it's a sheriff or if it's the local police department, if they're doing something to support people who come into or they're dealing with substance use. This may mean training, it may mean something else, but we want to make sure that we support those communities in doing really effective strategies. So the first thing you can do, this is an action item for you all, look at where your money's being spent in your cities. You can go to your city managers. As coalitions, you can simply ask your mayors or city managers, hey, how much do we receive annually from beer tax dollars? You can just say, how much do we receive? There's actually a report somewhere where that's one of the things I'm waiting on. And you can ask them, where do we spend it on? What do we do? This is not a time to be educating them just yet. First, you want to know the information. We're doing, I love the spiff. We're doing an assessment at this point. We're looking at what it is. Then you're going to be building a relationship with them, okay? Build that partner with your city, build a partnership with your law enforcement agencies, build partnerships with your Boys and Girls Club and YMCAs. All of those things will help you get partners and allies so that you can have a great conversation about where the best use of these dollars is. And I will be very transparent. It's not always prevention, but I do want to say that we only got 2% of the dollars last year. 7%. I have that little number in my head, not the normal. Anyway, it's 7%, not 2%. Don't mind my brain. 7% of the overall dollars from the beer tax grant went to prevention. That means that 93% of the dollars went to law enforcement and treatment. Guess what? If we are able to use more of those dollars towards effective evidence-based strategies, then guess what? We see a decrease in the need for those higher cost strategies, such as treatment or incarceration. So that's one of the things we'll get to. But right now, we're assessing and building capacity. That's what you're going to do, okay? This is specifically for the beer tax grant. We're also going to be looking at ways to increase the beer tax itself. Right now, it's set about a certain amount. We want to tie it to a consumer price index. I am working on a better way to explain the consumer price index other than just saying it's related to inflation. So you can actually see it, partly because my brain doesn't fully understand the very messy formula that comes out. If you are someone who loves numbers, contact us. Let us know if you like getting into that lead, like go for it. Let us know, and I want to understand this. We will be working with Richard Nance and Art Brown about this, but I'm going to have something for you, hopefully in the next 2 weeks, a meeting, and we'll have a plan for it next week with that. But I wanted to make sure you all could see it, understand. We'll hopefully make an infographic like Heidi has for other policy. The other thing that I would say is that looking at your local events, we just wrapped up a lot of the seasons, a lot of our fairs, a lot of our art, walk art, or art strolls. I'm trying to remember what these all are. My area has concerts all summer. What does the policy look like that the cities have allowed for alcohol? How do they monitor? How do they ensure that it's being consumed safely and that it's not being consumed by youth? Again, this is an assessment piece, asking those questions of your community. You can go to your city council and ask them that. You will probably have a Parks and Rec person. You might have someone at the county who's over it. Those are all things that I would suggest if you're looking for action item to find out what's going on in your community, they're the best people to ask. Then I want you to encourage, then I would encourage you to work with your coalitions and your youth to really build those relationships with your local elected officials. Don't just come at them during the legislative session and hope that they're going to listen to you. Building those relationships now. Drop off a treat, invite them to a back to school night event, invite them to a town hall you're having. You attend that town halls. I had a great key leader. I have to see who's on the call and see if I was going to give her a shout out. I'll just say who it was. So one of our mayors in our city, who happens to be the key leader chair right now of our coalition, she said to me, you have to show up. That's the biggest key, just showing up. She goes, yeah, it's a lot of time. She goes, but I will tell you, when you start to show up, you find out more information. You build those relationships. You understand why those parents are there advocating for their child, or you're there understanding why the city council is making a decision based off of this information. You don't have to do it by yourself. Please know that. Like, having your coalition members, almost knocked over my drink, sorry. Having your coalition members attend and you report back and tell you what they saw or what they heard. Building those relationships with PTA, so parent teacher associations. What other people are out there that can help you build those relationships with other elected officials and showing up. Share your successes on social media. If you go to, I'll use our, again, we have Blake Moore and John Curtis are our congressional representatives. If they have an event and you go to that event, share it. Get them engaged in your community, because we want them to come to our events and we want them to be involved and understand what they can do to support us better, because policy happens at all different levels. And we know this. It's not just federal, state, and local, but also schools and agencies and partners, our own agencies. Those are all things we really, really want to see happen. So, but don't be afraid to share that and build those relationships. One last thing is that as we go into a session, we are always, again, trying to be proactive, and there might be a partner you're building that's making a capital request. That means they are asking for specific dollars. And there are times where it might be in your best interest to support partners that are asking for those capital requests. Not all the time. I'm not saying all the time. I'm simply saying that there might be a new partner that you're trying to build a relationship with that you can help advocate for, or build a relationship with an existing official or someone. So maybe, again, those Boys and Girls Club, our police departments are looking for funding that's going to be better for your community. Because at the end of the day, we are coalitions looking to create and support healthy communities. And we know, hopefully, the continuum of care that we have that goes from prevention, primordial and primary, all the way up through maintenance. which we'll talk about in the end. So, all right, at this point, I'm going to pause and I'm going to ask if you have any questions about policy specifically, will you put it into the chat? I would love some really great ideas that we can work on for primary or primordial prevention for mental illness. That means the promotion of mental health. Are there things that are not just suicide prevention, which we'll talk about in a second, but what are some things you might know of? Let us know, because we want to come up with some really great policy and work with someone that's going to do something really effective, not just what feels warm and fuzzy. So if you have that, please share. Question. Okay, if our team, thank you, Catherine. If our teams want to hold a local legislative dinner, at what time of the year do you think is best? That's a really great question. So there's a lot of different ways to approach this. One way would be, do you want to get them to build a relationship now when they're not as chaotic? This might be a really good time around maybe October, after you've trained some of the youth so that they have that time to learn what to say, how to reach them. Then the legislative officials have that time to, again, build that relationship. And if they haven't made a decision on a policy that they already know exists already coming through the pipe, then they can impact it. We are going to have a legislative breakfast, so a Capitol Hill Day on Friday, January 20, I believe it's the 25th. I just have to look at my calendar. It's the first Friday. It's the 24th, Friday, January 24th, which is an opportunity your youth will have to meet with representatives up at the Capitol. The other way to do it is that prior to the legislative session, knowing that the session starts on Tuesday, January 21st, the week before or a couple weeks before might be a really good time to meet with them to bring something that you know is happening to the top of their mind. Okay, so there's two ways to go about it. But thinking about the time that they have, especially the youth and the legislators, your key leaders that are there, when are they available? Because that's where, if they're in a high stress or they're going to cancel on you real quick, that might not be the best thing. Sometimes breakfast. I heard from some of our rural areas, which I know that's where you live, Catherine. Well, I would consider it rural. I know it's not rural, but they might prefer something in the morning rather than a dinner. So that would be an approach which would be different and something that might be more relaxed and calm for them, because you want it to be an environment where the legislators and the youth feel comfortable talking with each other. So hopefully that answered some suggestions. If I had my way, I'd probably do it in October, November. You might wait. It depends also. Here's the other thing that just popped in my head. We have an election this year, as we do every November, but there are some people that may not be around in your legislative area come January. So be looking at those factors, building the relationships with them at that point. Hopefully that was helpful. But yeah. Okay. All right. Because we're going to keep on time, I'm going to move forward. Again, if you have any questions about policy, I am the current chair until about March, so after the legislative session. So please let me know if you have questions, concerns, want to get involved, any of those things. My emails will be at the end of the PowerPoint. Okay. September is a really busy month. That's my husband and my two kids, and I have two more, but they're not in school right now, so we don't need to talk about them. But you have a lot of stuff going on. You have universities going back into school. You have secondary and elementary going back into school. And you'll have a lot of new events like back to school night or a town hall or the parent nights that are required by the State Board of Education. Those are all things that you have going on in the next few months. Remember, we want to support, and our ultimate goal is having a healthier community. So what is going on? And obviously planning ahead of time versus right now. For our universities, getting involved with our universities at all levels. So not all levels, all areas, because everyone probably has an extension or a campus, a satellite campus from one of the universities, or Salt Lake Community College, or you've got University of Utah, Utah State, Weber State. It's great, great, great. BYU, all of those. Kids are coming back. They're having transitions. This is the time to support them and get involved at your local community, and getting someone from the university to see what they need and how you can support them might be a really great thing too, because sometimes these kids are moving from out of state. Keep that in mind. Secondary and elementary, so there's a lot of transition going from, it sounds strange, but sometimes third grade to fourth grade is a really big transition, and there's a lot of changes that happen. Wherever your middle school changes, that's huge. And then even from 8th to 9th, regardless if it's in middle school, junior high, or high school, they recognize that it counts now. So looking at ways to support those transition periods for our youth and parents, because guess what? I hate staying up late to do math. And my kids know that don't ask me at 10 o'clock at night to help you with your homework, because I'm not going to answer. But helping them understand those coping skills with parents as well, like how can they best support their youth and their neighbors. But there's other things going on just besides back to school. We have Mental Health Awareness Month. That's what September is. It's also Suicide Prevention Month, and it's a National Alcohol and Drug Recovery Month. Those are lots of big things. I'm not here to tell you which one to focus on or to do, but you can do most things as you plan for them, and you'll see what I mean. So, Mental Health Awareness Month. I chose this one to highlight first because we're looking at mental health, not mental illness. Mental health means, what are we doing to foster good health? When you talk about physical health, we talk about eating properly, sleeping properly, having good connection, walking and doing exercise. It should be of no surprise that since our brain is part of our body, our physical health, that it goes hand in hand with our mental health. So the mental health and the physical health have a lot of the same strategies. But I want you guys, I would encourage you, trying to be really clear that I'm not telling you to do everything. I would like you to hopefully look at the data. What are you seeing in your community? Not just the risk and protective factors, because that's where you start. You may have seen the student health and risk and prevention data that says this is an issue in your community, but why? What is it that your youth are experiencing or doing or having happen in your community that is decreasing that mental health or creating more stress, or there's a lack of coping skills? What do you know? That's what we have. We want to find that data again, the assessment and capacity piece. What do you already have in place? Hopefully, all of you on this call have written a great plan. That means you have already looked at the data, that you've already looked at why here. You're already looking at what effective strategies and are looking at ways to evaluate it. And you have a plan to implement said plan. And that should be your priority, okay? We really want to look at those partners. And I'll use again up here, we don't do certain strategies because we allow a separate coalition called New Hope to do those. They're the ones that are sponsoring the Suicide Prevention Walk in September. Guess what? I'm not sponsoring it, or I am not the one leading it, but we're helping support it. And we're encouraging people in our community to support it because it's something that's raising awareness. That's what we found based upon our data, that people don't know what to do and where to go to get the resources, okay? I would also encourage to find primary and primordial health prevention, mental health promotion. If primordial and primary prevention sounds foreign to you, let me do a really quick explanation. Primary prevention is something that we use the term upstream. So this is something looking at those risk factors, because we aren't going to do everything that's just focused on preventing death or use. We're looking at the factors that influence death or use. That's primary. This might be coping skills classes. It might be life skills, Botvin's life skills. Looking at things like parenting workshops so that they understand some skills that they can have to support their youth, or training that we have. Then on primordial is even further upstream. This is something that's creating that community change, that's supporting that why here, that local condition what is really going on that needs to be changed. Maybe it's policies or strategies in your schools, or that it's something going on in the community related to environment. There are a lot of things that we can do to support that. You may not be doing everything, but it is something that helps create that change. All right, last thing on mental health awareness, using your social media. I know that sounds foreign when we're talking about like helping with sleep and doing effective things, and sometimes social media can affect our mental health, but it's also a good tool. Go to where your target audience is. So Facebook, if you're trying to reach youth, is not your target audience. Okay, I just want to bring to attention that Lane put in there that the Student Health and Risk Prevention Survey is starting to like separate different types of screen time. So that's really, really good. And we see that sleep is really impacting a lot of our outcomes. Like, it's so, so important. My children know that don't mess with mom's sleep. And I have a really great pillow that's helped my neck. So it's been great. And finding great partners. Again, I'll say that, I feel like say again a lot, but it's not a bad thing. You are not the only people doing this. And you shouldn't be the only people doing this. You should have partners. You should have the schools advocating, you advocating, elected officials advocating and helping to make those changes that are helpful in your community for the youth, for the people who reside there, so that there is a culture of support, a culture of health. And that's what you're going for. And great partners help you reach that goal. Questions or comments for ideas about mental health promotion? I know this is being recorded, so I always feel weird being quiet. Oh, Heidi, you're reading my mind. Yes, selfie method in our community. And Heidi, if you could in the chat remind everyone what selfie means, because that is something, and I know that Casey had a link, I think we'll find it and put it in there or send it out. It is, I want to be very clear, the selfie method is based, so it's research based. They have not tested or evaluated the actual selfie method. But if you look at research based upon what are some promotion of positive health behaviors, it's the selfie method. And so there's years and years of research of it, but this particular approach is just different. But it is more of that, it is a universal approach. So that's a really great way, things to promote with our parents. And here's my thing, a lot of that primary stuff, people are just like, oh, it's really, yeah, we know we need to have the family dinners or we need to have this, but they just don't make time. It's not important until it's a crisis. Okay, we have from Lane, stop the stigma. Very good, changing that culture of it's okay to ask for support. It's okay to ask for help and talking about how we feel. And Megan, thank you. We're really like, I'm hearing that from, I spoke with Chat up at University of Utah about mental health screenings. And I spoke with a couple of counselors that are really hoping that screenings might be really useful for everyone so that you have that, again, assessment to build that capacity so that we can do that. Thank you so much. Thanks, Heidi. And understanding, Stacy, thank you, self-care. When we say self-care, it isn't just bubble bath. It is about how we are very intentional about taking care of ourselves. Are you doing exercise every day? Are you getting sunlight? Are you getting out and interacting with healthy people? Are you eating well? Are you sleeping well? All of those things you have to be very thoughtful about, and intentional is that buzzword. So that's what selfie is, and people tend to be like, I don't know. Like, I can go without sleep. I can study and cram for this test for this one night and I'll be fine. And it affects us. So, all right, I'm gonna move forward. Thank you for your interaction in the chat. The other thing is suicide prevention. Now, here's one of the things that I do really like about Live On. Live On has been focusing on some of the protective factors, which I will show you in a moment. But hopefully you have a plan, and Live On and the state suicide prevention plan are not on the same site now. So the state suicide prevention plan is posted on that PDF. So that's the link. Can you do that when I'm in here? Nope, you can't. I will make sure that when we send out the recording that we have the actual link so you can actually click on it. And then Heidi will have these slides anyway. But look at how what you're doing is to complement. You're not doing the exact same things as the state suicide prevention plan, but how are we working with it? How are we supporting it? Does it make sense in our community? Those are things that only you can answer, only your coalition can answer. So be thinking about that and reading through if something makes sense to you. Oh, thank you so much, Brooke. I appreciate you putting that in there. liveon.org, they liveonutah.org. They have a number of resources that are available, and it is something that you can access and look at different populations. A lot of it's a similar strategy or resource, but they do have it broken down by like faith, schools, parents, individuals, military, LGBTQIA, like all of these different populations. If you're looking to support them, what can you do? And Live On has that there for you. But a really great thing, because we work in prevention, is promote protective factors. What are protective factors, you ask? Glad you asked. These are protective factors. And I'm putting this matrix on here for a very specific reason. If you look at the right-hand side where up there it says depression and anxiety as the outcome, because along the top are the outcomes, and you go down and you follow the check marks. So you have cognitive competence, social behavioral competence, belief in the future, pro-social norms, and recognition for positive behavior and bonding to socials and family, school, and community. Those are the protective factors that influence depression and anxiety, okay? You're not looking at emotional competence, you're not looking at self-determination, and it's just right now. This is data, the most current data we have. Does that mean that tomorrow they might release a new report where we add more check marks? It could. I'm not that person that knows yet, and I have not seen it, but it could change, and we're okay with it changing. But this is where it is. Paul, did you have a comment? Or are you just being a nerd and coming off mute? You're off. Okay, thanks, Paul. You just like to interrupt me at all times. It's fine, Paul. And I say that because I know Paul. That's not being mean. I know Paul.
I apologize. You're right. I was being a nerd.
It's okay. We get excited. But when we start looking at the strategies we're doing, which may be like, oh, we're going to totally focus on self-esteem. Is self-esteem going to fit in our social behavioral competence? That's what, like, those are the things that you need to make sure that what you're doing is going to be affecting it. That's right, Brian. When you're in prevention, so good. But there's a lot of things that we focus on, and there's a great research on that bonding to pro-social with others and the recognition for positive behavior. If you've heard of social development strategy, that is something that I believe there's a, I'm trying to think if there's a training. I just read another one. It's the, it's a like coordinator mini training for coalition coordinators that we're doing in our area. That's what I'm thinking of. I apologize. But there's social development strategy, and that's something that you can do in your community or support these events in your community. Say you have a kid that really loves, I'm going to go with the nerd culture, FanX. Okay. There's good and bad. Everything's got good and bad, but are there ways that they can bond with someone that's connected, that they can connect to? An example with my redhead, she has a genetic disorder, and through FanX, we connected with the first person I had ever met that had the same genetic disorder. It's an orphan disease, but same genetic disorder. that she had. So it allowed her to connect with someone that was similar, had similar experiences, was an adult, because that was the fear we had at the time. Like, what does this look like in adulthood? And guess what? Like, it created a different expectation and way to deal with her own issue. So that helped deal with some of the depression and anxiety she had about having this issue, which, of course, you know, when you have a genetic disorder, it's just how it is. Can't change it, unfortunately. But those are the kind of things. Be looking at what are the pro-social norms. If you had the privilege of going to the Bryce Canyon Summit pre-summit, which was the Montana Institute, you might have learned about pro-social norms and about ways to build that relationship, focusing on the positive. Those are the kinds of things that can actually affect both mental health and substance use. There's data for that. And that if you're lacking dollars for mental health, gosh, maybe you look at some of the things that address pro-social norms in your community, if that's the issue, with a positive campaign, which will likely impact our substance use and mental health issues. So those are the things I really want you guys to be thinking. I would encourage you all. I am not your boss, I apologize. I would encourage you all to look at, okay? Next, the last thing of the month that I'm aware of, I looked up all the months, was the National Addiction Recovery Month. And we have in our area have a great opportunity to work with UPCA, and it's a group of recovery advocates, and they're amazing, amazing people. If you've not met Evan Dunn, or if you've not met Brandon, and I'm blanking, or Braden, I can't remember Braden's last name, I think it's Robinson, David Sekulich, Mary Jo McMillan, all those people are amazing and want to support, because a lot of people in recovery are parents or aunts or uncles. Finding a way to support them is great. Thank you so much, Lane. We want to make sure that they are seen and are involved in the community. Goes back to those protective factors. They're being able to share something if they're well trained in ways to prevent, making sure that they're being celebrated for health. And it was actually Mary Jo McMillan who encouraged me as a woman in long-term recovery to be very comfortable talking about my recovery rather than always focusing just on prevention, which I do. I only focus on prevention, but like embracing that as part of my prevention approach. And those are things that if you have someone in recovery that's been trained and understands how to speak to youth or other partners using your peer supports, they're going to get engaged and help with that overall goal of healthy communities. And we want to look for those skills, give them the skills to be better parents or better residents, giving them the skills to know how to cope with stressful situations. Looking for where they know to go for resources if they're struggling with employment or they're struggling with food insecurity. Those are like, everyone should be at the table, and it changes how we support each other when people in recovery are included in the conversation. So there are events that happen throughout the month that are for suicide prevention, for mental health promotion, and for recovery. And go there, be engaged, look for ways to support them, invite them to be a part of your coalition, and invite them to be a part of changing our policy. UPCA is what's the right word? They're a powerhouse at the Capitol during the session. They are a great partner to have, and I cannot stress enough having those conversations. Getting a bit emotional because I really do love working with them, and they are wonderful. And thank you to all of them being a part of that. So if you're not catching, Lane is putting some amazing resources. Thank you so much, Lane, because again, I told you I'm not the point person, but Lane is putting some really great suicide prevention resources in the chat if you have not looked at those. Okay, I want to give you some words of caution though. We want to feel really good about what we do. That's why we actually are engaged, whether you're a volunteer or a paid staff. A lot of us we have passion for this. We have passion for creating a healthier community. We have passion for supporting the youth and adults in our community to making healthier choices. So because of that, don't make it up. Just saying, gosh, it sounds like a really great idea is something, and you start going into this great, what you think is a great strategy, but it's not been tested. It's not been evaluated, and there's no research behind it. Please, please, please be thoughtful. A lot of the things that have come up in our communities that are great events have a side where they're not as effective, and we're putting a lot of money into them that may not be effective. And maybe you're doing an event where there's more harm than good that comes from it. And that's something that we have in our prevention ethics and our prevention guidelines: do no harm. So be thoughtful of what we're doing. Next, evidence-based strategies aren't just programs. They aren't just like Botvin's life skills. Strategies is a whole host. And if you've ever been trained in the CADCA model, you'll know that they call them 7 strategies. Well, strategies include policy. Strategies include ways to recognize each other or recognize our partners and remove barriers. But you're looking at what's effective and finding the research that supports a positive impact on your community. A lot of the times people have thought, let's just focus on treatment or getting people to talk about suicide. I think that's a really good thing. We should be talking about it and having those not uncomfortable conversations, or uncomfortable conversations, so that you can say, oh, this is the issue. But if you don't follow it up, if you just say, let's talk about it, and then nothing happens, that may not be as effective. So looking at what your community needs, please do it. If it's not in your plan, maybe this isn't the year to do it. I'm going to put it out there. I'm not saying don't focus on these things, but prioritize your own plan. If you've taken the time as a coalition, which hopefully you all have, to look at the data, build that plan, implement that plan, we will find ways as partners, as state agencies, as local agencies, to support that plan. And if something comes up next year that we like throughout the year that you need to do, let's do it. Let's find a way to figure it out. But don't just make it up. Don't just say, oh my gosh, we have to do health promotion or mental health promotion this month. I'm not telling you to do that. I'm telling you to focus on your plan. And if it's in your plan already, great, awesome. That's great. Let's focus on it. But don't just be like throwing your plan to the side because all of a sudden you have another $500 to do something different. Let's see how our plans can be complementary of each other. And lastly, please evaluate. Please evaluate. An evaluation can be doing focus groups. An evaluation can be looking at what survey data have been out there. Asking key leader, it's a lot of stuff you did when you were doing your assessment. But don't just do something and hope that it's effective. And then because everyone loves it, continue doing it. I love certain events that go on in my community. That doesn't always mean they're most effective. That doesn't mean that they're bad. It just means that they're not as effective at their overall goal. So looking at what your goal is and seeing if it complements, and then evaluating to see if you're reaching that or making progress towards that goal. And we work in the field of community promotion, community prevention, which is very different from individual. And so we're looking at something that's very large in that public health domain that sometimes seems unwieldy, but we can evaluate it and see if it's effective. It just takes a little more time and support. So resources for your evaluation, Bach Harrison, you have the state, what's SRI? Social Research Institute. Is that what it is? It's one at University of Utah. Working with your local substance authority, local authority. Working with your universities. They all have, if you have, so social work, sociology, education, and psychology all have students that need to do an evaluation project. Those are places to go to start. If you want someone to do that for not free, but like help you through it to like, they can do the legwork. Work smarter, not harder. So last thing, that's my contact information. If you have questions or ideas so that we can, especially with policy, because that's who I am, is the policy chair right now, reach out and say, hey, what do you think of this? Not everything, won't shoot down everything, but like, not every idea is something we can work on every year. And we do have those substance use priority issues, but if you have something, because we want to be proactive, again, the idea is to be proactive, helping families and community members, community residents be healthy. That's what we want our goal to be. That's what I'm hoping we can do with that, like if you have ideas. So that was my presentation. It is 12:45. I will take some questions now. First question, do I look like a school marm? I tried my best to look like or my sweater. I really do, like, this is an outfit I don't really wear, but I like put my glasses on. I thought about wearing a bun, but I was like, oh, it looks a little weird today. So I need to look a little more school marmish.
We appreciate your cosplay. It's great.
Well, I was like, I'll do this. And I was actually called because when I was in high school, I had glasses that looked just like this. And I would my hair in a bun, and people told me I looked like one of our older teachers.
Oh,
good thing I loved that teacher.
Yeah.
So.
If the glasses were actually horn rimmed, it'd be believable. I'm just having trouble.
I actually have ones that are cat eyes that I broke. And I'm like, oh man. So,
there we go.
So thanks, Paul. School mom, thank you so much, Christy. I'm a school mom. Okay, I'm gonna give you 1 more minute. And then I'm gonna be quiet. And I can't see that there's my time. So while we're waiting for those questions to pop up, do you want to do your wheel of names?
Yes. Yep. All right. Thanks everybody that took the time to do the survey and entered yourself into the drawing. So we'll draw 3 today. So let's let fate decide. Oh, Tanya Schilling. Awesome. You write this down so I don't forget. Tanya. Oh, I guess I'll have it recorded. Let's do another. Oh, Taylor. Awesome. Okay, one more. Britta Watts. Awesome. I will reach out and let these folks know. And if any of you know them, feel free to share the great news. Yeah, thanks, Barbie. Did anybody come up with any questions for Susanna? All right.
You have that epiphany in an hour, you can email me.
Yeah. Yep. As you guys are trying to fall asleep tonight, you'll be like, oh, Eureka, I thought of something. So we'll send out Susanna's contact information with the recording and all the cool resources that you guys and Lane put in the chat. And be sure to tune into next month's webinar. We're very excited about this one. Some of you may know that we, the UPCA and the UPN, signed an MOU with the Utah PTA a few months ago. And a lot of people have been asking, well, what is that? Like, what does that MOU entail? Like, how are we working together? So next month's webinar will be with our partners from the Utah PTA and some of our local prevention folks. And we're going to be talking about what the PTA is, what they do, how they can work with coalitions, how we can work with them. And we're going to be sharing some resources that, yeah, a lot of acronyms. We're so excited about this webinar, so make sure to tune in. We want to give you guys the opportunity to have breakout sessions with your local PTA people. So we may ask you to do like a pre-registration before the webinar so we can see who's coming from what areas and make sure that there are PTA representations from those areas. So more information to come on that, but we're very excited. So if no one has any questions for Susanna, thank you guys so much for attending. Thank you so much, Susanna, for stepping in and presenting today after like 1 day's notice. You are a rock star. We really owe you big time. Thanks, everyone. Have a great month, and we'll see you in September.
Happy back to school.
Yeah. Bye, everybody.